When you are sick, your body tells you so. Sometimes you feel more tired than usual. Other times you have a sore throat. Other times you know you have a fever because you can't stop shivering. Our patients can have both physical and behavioral signs and symptoms when they are sick or unhealthy. In this lesson, we will be focusing on the physical symptoms so that we know what to look for and how to look for some of the most significant symptoms that can indicate illness. Remember, always check the care plan so you know what physical symptoms are new or worse. One physical symptom that could be concerning is shortness of breath. You can notice shortness of breath by hearing or seeing your patient take shallow breaths, or noticing they need to take frequent breaks. Another physical symptom to watch and listen for is a wet cough. A wet cough is a cough that crackles or produces phlegm. You can notice this symptom by listening for the wet cough sound, seeing extra used tissues by the patient's bedside or coffee table. Another potentially dangerous physical symptom is a fever. A fever is a sign that the body is trying to fight off an infection. You can watch for signs of a fever by noticing if the patient is shivering, touching the patient's forehead to see if it's warm, or using a thermometer to get an accurate temperature reading. Here's another change you should notice. If a patient feels cold all the time.
Hey there, George. How is it going today?
Hello there, it's awfully cold in here, isn't it?
George, I'm surprised to see you with a blanket, because your thermostat shows that it's 75 degrees here. Are you feeling a chill or shivering?
Sometimes, concerning physical symptoms may not be easy to see, feel, or hear. One example is heart palpitations, where your patient may feel their heart skipping a beat or even racing. You can listen and observe. Does the patient put their hand to their chest frequently? Does the patient seem distracted or worried? Does the patient seem out of breath? Does the patient verbalize something not feeling right with their heartbeat? You can notice some physical changes or symptoms while you offer personal care assistance. For example, you may notice dark or strong-smelling urine while assisting with toileting. Or you may notice that your patient is going to the restroom much more frequently than usual, or that they are having pain while urinating. Finally, you may notice another alarming symptom, fast weight gain and swelling, while assisting with dressing tasks. We typically see them when trying to put on our patient's socks, as swelling usually happens in the ankles or lower legs first. Keep your eyes and ears peeled for any sudden physical changes that could indicate a concern. Wet cough, fever, heart palpitations, dark urine, rapid weight gain, and swelling in the feet or hands. Not sure if the change is a concern? That's okay too. If you notice a change, tell your agency supervisor about it and document it in your care plan app before the end of your shift.